Hi, welcome to the 2022 Executive Functions Summit. I'm Fazia Costi, and today we are meeting with Alisha Peterson from Continuum Behavioral Health. She is the Director of Clinical Services, and Alisha completed her undergraduate degree at the Metropolitan State College of Denver in psychology. Alisha went on to complete her master's degree in counseling with an emphasis in school counseling, and later completed another master's degree in applied behavioral analysis, which is ABA, from the Chicago School of Professional Psychology. Alisha has experience working in the mental health field for over 10 years and has worked with children ages 3 to 13 who have been impacted from trauma, abuse, and complex mental health issues. Alisha entered the world of ABA in 2015 and became a board-certified behavioral analyst in 2017. Alisha has worked with individuals with varying levels of developmental delays as well as behaviors. And she is currently, once again, like I said before, the Director of Clinical Services with Continuum Behavioral Health. So welcome to the summit, Alisha.
Thank you so much for having me.
You know what, it's my pleasure. I'm really excited to talk about ABA therapy because not everyone has a good feeling about ABA therapy. In fact, I hear a lot of kids who've gone through ABA therapy, when they come to me, they're like, well, you don't use that, do you?
Yeah.
And I don't. So I tell them naturally that I don't, but I want people to have a better understanding of what ABA therapy is. So let's start with the definition of ABA therapy. But before we do that, I'd like you to just talk a little bit more about what it is you do in your position and talk about who you are.
Yeah, thank you. So I'm based in Denver, Colorado. I started with Continuum Behavioral Health back in 2015 when I decided to switch my career and, went through my supervision, became a BCBA, and then moved into the clinical director role for the Denver, Colorado location. We have 16 locations. I think we're up to 17 now, 17 locations with Continuum Behavioral Health. And over the past year to 2 years, I have expanded my region to cover Colorado, Utah, Arizona, Wyoming, and Texas. And a month ago, moved into the Director of Clinical Services role where I'm providing company-wide support, which is really exciting. Continuum Behavioral Health has been around for 10 years. It's connected to the Pediatric Nursing Company, which has been around for 30 years. So there's a long history with this company. And really what makes Continuum so unique, I think, and what has kept me with this company is that we continue to shift with how things are shifting and continue to learn and really take a unique approach to how we are working with individuals and families and putting that quality of care over that quantity of clients that we serve is at the utmost of our, where we want to have our priorities.
No, and I love that. I love that you put your clients at such a high priority because you work with a very delicate population and they need that. So I love that you do that. It's very important. Let's define ABA for those who don't know what it means. What does it stand for, and what does it mean?
Yeah, so applied ABA stands for Applied Behavior Analysis, which is, we use a scientific approach to behavior. It's just behavioral science. We're looking at using everything that we do. All of our interventions are evidence-based. So there's been peer reviews on strategies that we use, really pulling from the information that's out there. There's no cookie cutter therapy for ABA. And so it's making sure that you are taking the best approach for your client, because every client is going to be individualized. And the biggest piece with ABA is making sure that you're staying up to date on the research. It's always changing. And that is what we use to create skill acquisition with our clients, help them build those skills if they're looking at potty training, or if they're working on social skills, or if they're, entering adulthood, or they are already an adult and looking at vocational skills and vocational training. We use that approach to help them build that skill development, while at the same time looking at what are some really challenging behaviors that limits their ability to access their community. Maybe they have really severe self-injurious behaviors, or they have high rates of aggression, or those are behaviors that we want to target for behavior reduction. And again, using that evidence-based model to make sure that the interventions that we're providing are appropriate.
Yeah, thank you for sharing that. So tell me a little bit about your client. What age groups do you serve?
So we serve as young as, in the Western region, I think our youngest client right now is 2, but we can go, we have an early milestone, I think it's called Early Milestones program that is also utilized out in Florida, especially. So as early as infancy, if you're starting to see some delays, we have some clients that we can work with through adulthood. The oldest client that we've had in the Western region, I believe, was about 56, but really it spans the lifespan, which has been a really unique experience for me, because when I was in mental health and I was at a residential treatment facility, it really was that 6 to 13-year-old population that I was used to working with. Working with adults has been a tremendous experience for me.
Yeah, it really is a little bit different, isn't it? So I'm assuming that changes your approach.
It changes our approach. With any client that we work with, we want to make sure that we have their buy-in, that they are involved in their therapy process. And you don't want to just come in with your own agenda, right? We've done the research, we have strategies, but the families know their child best, or the child knows themselves best. And so making sure that the adult knows themselves best. And you want to make sure that they're a part of that process, right? If I'm working with an adult and he says to me, I'm really struggling to keep a job and I have a lot of conflict with my coworkers, that is what I want to focus on for him. That's what's valuable to him. He wants to keep a job. He wants to be able to have conflict resolution, and potentially that leads to him finding a place to live independently, right? So those goals are going to look differently than, let's say, a 3 or 4-year-old that comes in and the parents are like, we'd really like to work on potty training, and we'd really like to work on some school readiness skills. Maybe if they're like 4 or 5, getting closer to entering into the public school system. But regardless of, if it is a child and you're working more closely with the parents, or if it's an adult and you're working more closely with the individual themselves, you want to make those goals meaningful for the individual that you're working with.
Yeah. So does everybody who comes to your organization for services have to be on the spectrum?
No, I think that is a common misconception of ABA, is that you have to have a diagnosis of autism spectrum disorder to benefit from the services of ABA therapy. And we know that is private insurance has kind of pigeonholed the world of ABA into that, because we know that it is a medically necessary service that they've identified. But ABA, I have clients without a diagnosis of autism, mental health diagnoses, ADHD, Down syndrome. My son has Dravet syndrome, which is a very rare seizure disorder, and he benefits from ABA. And so we can definitely work with a large population. I know individuals who work with traumatic brain injuries and, some of those other disorders that aren't as widely recognized that would benefit from ABA. Like I said, ABA it's a behavioral science, right? So we're using behavioral strategies to increase independence, increase success for these individuals. And it's not pigeonholed to autism.
No, I love that. And I thank you for explaining that, because I think, at least from my perspective, whenever I hear of anybody talk about ABA, they assume it has to do with a diagnosis that's on the spectrum. And I know that it doesn't, which is why I really wanted you to clarify that.
Yeah.
What are your core values and approach when working with kids and families?
So, like I said, our biggest value with Continuum, and just me personally as well, is that quality over quantity, right? So when you first meet a family, every approach that I take as a BCBA is from that trauma-informed lens. And I think when people hear trauma, they're like, oh, that has to be a really big event, like neglect, abuse, adoption, something like that, right? And trauma happens daily for each of us. And these families are experiencing trauma in the extent that they have a child that they're trying to navigate through this therapy world, and they're tired and they have all of these therapy appointments, and or there's, you know, a medical component. They might be medically fragile and they're trying to navigate that system and might have some medical trauma, and the child might have some of that as well. Trauma can be just a disruption in, you know, a family moves and the child has to switch schools, a divorce, something like that. So every approach that I take with the families and children comes from that trauma-informed lens, really looking at big picture of what exactly is going on. What is the best way to work with these families, and making sure that we're taking that holistic approach to therapy, right? We want to make sure if there are other providers involved, occupational therapists, speech therapists, physical therapists, mental health counselors, that we are working with the entire team, right? I do not know more than the occupational therapist. The occupational therapist doesn't know more than the speech therapist. We all have our little subspecialties, but it works best if we're all working together, right? Because we're all working towards that common goal for the family.
I love that. You know, I always tell families when I'm working with them and they have other providers, I said, you know, you're doing all the right things. You have the therapist, you have the ABA therapist, or you have the neurologist, or all these different therapies and doctors working together. You have them all. So you're doing the right thing for your child.
Yeah.
You just have to now be patient and let them do their work. And because no one person can meet all their needs. And so I like that you're so willing to work with other therapists and really get that child where they need to be, or that adult for that matter.
Yeah, it's so important because, again, we're all working towards that common goal, but it's also, along with working with all those other therapists, going back to what is important to the family, what is important to the individual, because what I think is important might be different than what the family's values are. So making sure that I'm not putting my agenda above the family's, you know, the family's goals and their values and what is going to be important to them. But also a big piece on that caregiver education, right? Making sure that the parents feel involved and included. You know, I, like I said, my son, I have a child, a neurodivergent child. Well, I guess he's not a child anymore. He's 19. But he has Dravet syndrome. He's been having seizures since he was 6 months old. And I have been on this journey as well as a parent. So as a parent and as a professional, I've done this journey, and I know how overwhelming it can feel to be like, given the recommendation that you need this therapy, this therapy, this therapy, this therapy, but then you also want to have a somewhat normal life, right? So including parents in what makes sense, how do you plan the therapies, how does it fit into their world, and also allowing the individual to have normal experiences to life, having access to vacations, having access to just downtime to, you know, play video games or have family nights, do those pieces. And I think, you know, we can recommend all of the therapy in the world. It has to make sense to the family and it has to feel right. And that's how you really develop a cohesive therapy team.
Yeah, no, I love your approach. I do something very similar. I really do like to include the family, and my goal is always to be kind of making my way out the door. So when I walk in to work with the family, I want to make sure that they're successful, because their success is my success.
Yeah.
And so if they're successful, then they can move on and live that normal life that we've been talking about.
Absolutely. We want to work ourselves out of a job. We don't want to be there. We want them to be able to sustain. And it does get more challenging as they get older, and adult services, there's not as much access, and really making sure that they have the tools to continue to support the needs that are there, and that they feel confident in doing that is important.
Yeah, thank you for sharing that. What does a typical therapy session look like for maybe a child versus an adult?
So I find this question to be very interesting, because I don't think there's a typical therapy session. But I do think that a lot of people have in their mind, this is what typical would look like for a therapy session. And there are some key components that look very similar. When you are working with a child, regardless if you're working in a clinic setting or if you're working in an in-home setting, and the majority of what we do is in-home, but we also have clinics. But I've been doing in-home services since 2 years prior to working in ABA. I was doing it in mental health as well. And I love working in the in-home setting. But it's really, again, having those goals laid out, right? What are we working on? Having programs developed, pieces of curriculum developed for the individual that really kind of target that skill acquisition. What are we working on? Are we working on social skills? Are we working on potty training? Are we working on being able to wait for something? We can't always get that immediate access to what we want in life. And so sometimes just teaching an individual how to wait can be helpful. But, a typical session might look like somebody coming in and, getting their materials set up, and then it looks like a lot of play. There's not, I think a lot of times people have in their mind this idea of therapy being very rigid and very sterile, and we're sitting at a table and we're doing cards and, going back and forth. And when you look at kind of the history of ABA, I do think you see that a lot. When you're looking for examples online, you see that a lot. And not to say that there aren't times that we might be looking for some fluency with skill development, and we're doing some more of that more formalized therapy. The majority of what we do, it looks exactly like play. And I have conversations with parents all the time that this may look like play, but we are working on a lot of things, right? We might be playing this game of sorry, but we might be working on being able to tolerate losing, or taking turns, right? How to ask for, or advocating for yourself, saying, I want to be the red player instead of the blue player. All of those pieces can be tied into therapy. So it's really, how do you work those in naturally? And then when
I love that, because I do the same thing. I play a lot of games teaching executive function skills.
Yeah.
So I love it. And I think parents need to know that that's an easy way for them to reinforce those skills at home.
Exactly. And play is so powerful. We know this. We know that when we're working with children, that play is a powerful, powerful tool, and it really gets them engaged. It gets them to buy in. They don't even know that they're building their skills at the same time that they're, that we're engaging in all of this. And you see so much progress being made if you make it fun. So
absolutely.
Yeah. So that's, that's a key part of the therapy with adults. It's really, building that relationship. How are we making it worth their time? They can, if an adult is their own guardian, they get to say whether or not they want to participate in therapy. So we have to make it feel valuable to them. And which, again, sitting down, making sure that our, their goals are aligning with what we're seeing that, as some skill deficits that maybe we could be working on, and having them develop their own plans, or being at least a part of it, right? Like if we're focused on budgeting, what would make sense? What are little things, that we can work on? I had a client one time who I was like, I think it would be great to get a calendar, like a calendar schedule book. And he looked at me and he was like, yeah, I'm not doing that. It's like, okay, let's find something that would work, that we can at least track, when we have to make a doctor's appointment, when we need to refill our medication, how much money we have to budget with, what does make sense, but it's working together with them to really make it meaningful for them.
I agree. I think you have to customize it to everybody to make sure that they're comfortable with what they're doing.
Yeah.
You're right. A written calendar is not going to work for everybody.
Yeah.
Yeah. What are some very common misconceptions about ABA therapy? Let's talk a little bit about that.
Yeah, so ABA has a history. We know that ABA has a history, and it's not the best history. And I think it's important that we as BCBAs continue to talk about that and acknowledge that that is in our history when you're looking back to how ABA came about and the behavioral science around it. That is not ABA anymore. That, those practices are not ethical. We have a very strong standard.
Can you talk a little bit about what those practices were?
Yeah. Well, so when you're looking back to like the 70s, looking at, there were a lot of use of punishment procedures. Okay. And when we're thinking about reinforcement and punishment in the world of ABA, reinforcement is anything that's added, okay, after a response that will increase the likelihood that a behavior will occur again. That's it. Okay.
Give an example.
Yeah. So if you, I just completely blanked there for a second. So if I want you to, you're working on a task, let's say you're in a classroom, right? And you're working on your work, and I come around and I say, you're doing a great job working on your work, and I give you a high five. That's reinforcement. As long as you enjoy getting high fives and social praise. If you don't enjoy that, then that's not going to be reinforcing for you. But
Right.
reinforcement increases the likelihood that a behavior will occur again with the addition or removal of a stimulus after a response. Okay. Punishment is the addition or removal of a stimulus after a response that will decrease the likelihood that a behavior will occur again. Okay. So when you're looking at, people, it physically makes me have a response when I even think about the use of like electroshock therapy
Yeah.
to decrease
It's
response.
going to come back though. A little bit.
So there's a lot going on in the media right now, I think, around some things that are happening at a certain facility out east. And that also is getting associated with ABA, and that is not ABA. That there's a huge group of us BCBAs on different websites, different platforms, who are saying, this is not ethical. This is not okay. This should not be in the same realm of what we do.
Yes.
Right?
Thank you for clarifying that.
Yes, because we know that per our ethics, we should never be looking at anything without reinforcement. We need that reinforcement. That's what makes people, continue to do the things that they want. I've had this conversation with parents all the times of, well, you can continue to remove everything from them and they're not going to have anything left. There's not going to be anything to motivate them to do anything, because they're just going to be like, I lost everything. I don't care. And I'm just going to keep doing what I'm doing. Right. If I lost everything, I wouldn't care. And I'd keep doing what I'm doing. You have to have things that are, highly reinforcing. And, I think another common misconception of ABA is that our goal is to evoke behavior so that we can make behavior change. That is not our goal. There's definitely a shift in the assessments that we're using. And, we don't want to see those really highly challenging, highly dangerous behaviors. We want to intervene before those behaviors occur. We want to make sure that we are not putting the individual at risk of hurting themselves or others. We don't want to try and get those behaviors out. We are putting every intervention in place to be proactive. And I think that is one of the biggest misconceptions that I see, is that ABA is a reactive therapy. And, and we are a very proactive therapy. We don't want to see these. It'd be great if I heard from a parent that they engage in, X amount of self-injurious behavior, but then we begin therapy, we put the interventions in place and I never see it. that would be an ideal situation, right? Because then I know that what we're putting into place is working. They're not getting to the point where they're escalating, again, coming from that trauma-informed approach. We want our clients to be regulated. If they're not regulated, they're not available for therapy. If they're not feeling good about things, they don't want to participate in therapy. They don't have that buy-in. And
Right.
so I think that is one of the biggest misconceptions, is that, ABA has this reputation of being very sterile, being very rigid, creating robots, is what I've heard from the community when you listen to voices of individuals who have been in ABA therapy previously.
Mhm.
And that is not what we are doing at all. We're working on the clients having voices, honoring assent withdrawal, looking at, again, what is valuable to them, that caregiver education piece. I have some families who really want to work on reducing stimming behaviors. And if it's not interfering with their learning or their access to the community, we're not going to touch that. That's just a part of who they are. That's, that is helping them regulate. That is helping them get through and navigate the world. We all have different things that we engage in. And so I think that's a big piece. That's a big misconception, is that ABA is looking to, quote unquote, normalize these individuals. But what is normal? Right? What is normal? How are we defining how they should, function in society? The biggest goal with ABA is that they can access those successes, they can touch those successes, they feel confident, they feel like they can, live the most independent life they possibly can. And we know that there are varying degrees of, support that each individual requires, but you want them to have as much independence as possible. You want them to feel good about themselves and have that confidence and, just feel comfortable going out into the world and living life.
I really appreciate you sharing that. And I love the passion you have for what you do. I think everyone should have that kind of passion for what they do. It's what makes you good at what you do. Any recommendations that you have for parents or individuals who are going through ABA therapy?
I would definitely recommend, if you're just getting started, if you've been recommended to seek out ABA therapy, interview different companies. Every company is going to have different approaches.
Mhm.
And, you have to find the right fit for you. Every individual has to find the right fit for them. And it does not mean that there's anything wrong with one therapist versus another therapist, but we're not going to mesh with every single person that we work with, right? You
Right.
have to find the right fit for you and for your child or for your adult. You have to find the right fit. So spend that time. Don't hesitate to use your voice as well to advocate and say, I'm not feeling this. Can we do a meet and greet? Can we just do a trial run and see how they interact? That's okay. It's not typically offered by ABA companies up front, but if you ask for it, they're going to give it to you. They want you to feel comfortable. Get on as many wait lists as possible, because there are wait lists everywhere for ABA. And after you get a diagnosis, after you've been told that this is a therapy that you may want to pursue, you don't want to wait a year or 2 years to start that therapy. You want to start an effective therapy as soon as possible, and make sure that it feels, you feel like it's going in the direction that you want it to go. Again, advocate, use your voice. I know, as a parent, again, a parent of a child, that sometimes you feel like you can't just be like, I can't do this today. This is too much, because you want to, okay, yes, I hear what you're saying. Let's do this. Use your voice. And a good therapist is going to listen to your voice and realize, all right, you cannot take data today. This is too overwhelming. Or let's push the caregiver training to tomorrow, because yesterday you spent the entire day at the doctor's office dealing with blood draws or this or that. Use your voice. And I think as parents, we oftentimes just want to kind of just go with the flow and then we get burnt out and exhausted ourselves. Make sure that you're taking care of yourself as a parent, because that self-care, that self-resilience piece is so key. If you don't take care of yourself, you are not available to advocate and take care of your individual.
Yeah, no, I'm a big advocate of modeling behavior.
Mm.
And I think if you want your children to take care of themselves, you have to show them how to do it by modeling that behavior.
Absolutely. Absolutely. And again, the advocacy piece too, right? Like you want to model that advocacy. You want to use your voice and teach your child to use their voice. I think one of the biggest things that I hear, and again, a misconception of ABA is that we want to create these, that the therapy creates compliance or focuses on compliance. Compliance is a trigger word for me. I do not want my clients or my children to be compliant because they need to be able to use their voice in the community. And when we're working with a really vulnerable population that can be easily taken advantage of, and I've seen it firsthand, and it is devastating, you want to teach that advocacy piece. You want them to have a voice. You do not want them to just be compliant to whoever is telling them they should be doing this.
Oh, I agree. I've seen some kids end up in some really bad situations because they just didn't know they could say no.
Right. And I think that that's a big note for parents when you're in ABA therapy, that is a goal, that self-advocacy should be a goal for every client, that they should be learning to use that voice, have that, assent. Yeah.
Well, when my daughter was 3, I remember taking her into the pediatrician's office for a checkup. I think it was her annual checkup, and the pediatrician was very rough with her. And I was like ready to say something, and my daughter beat me to it. She said, "Stop. I don't like the way you're touching me."
Wow.
And the pediatrician just looked at me. She goes, "What do you want me to do?" And I said, "Well, she just told you what you needed to do. I'm not going to disrespect her wishes when I'm the one who tells her to advocate for herself. When I'm the one who tells her, if someone doesn't treat you well, you need to tell them, and you did not treat her well." I said, "She just beat me to it. I was ready to tell you to stop." She was just flipping her around like she was a doll. And I'm like, nobody likes to be treated like that. And a pediatrician should know better. Yeah. And so, but I was so proud of my daughter because at 3, she stood up for herself.
That is incredible parenting on your part, because you modeled that for her. And then she, at 3, she used her voice to tell a person in a position of trust, a doctor, to stop. Because it didn't feel right. That's incredible.
And she felt so confident in her decision. She's like, "No, this doesn't feel right. I'm going to tell this person." And she just stood there like, "I have every right to tell you this." And I thought, yes, you do. And so we got our stuff and we left. And I thought, if every child could advocate for themselves in that way, they wouldn't end up in difficult situations, at least not as often, hopefully.
Well, they might still end up in difficult situations, but they would have a lot more tools to navigate through it, right?
Right.
That's incredible. Wow.
So, but hey, I just want to thank you so much for coming onto the summit, for sharing your wonderful and valuable information. And is there any last tidbits that you want to share before we end our time together?
I really appreciate the opportunity to come and talk. And I would encourage anybody who has questions about ABA or who maybe has had a bad experience with ABA prior to this, or a really great experience to ABA, but maybe, stopped therapy for one reason or another, reach out with questions and, continue that dialogue. And if there are things that have not felt great when you've gone through ABA therapy, continue talking, because we are listening and we are making a lot of changes in the world of ABA, and the direction that's moving is pretty exciting. And there's so much benefit from ABA therapy that I don't want families to lose out on that.
Well, I really appreciate that. And how would somebody get in contact with you if they wanted to reach out to you?
Yeah, they could go ahead and email me. My email address is apeterson, PETERSON @continuum, CONTINUUM group.net.
Thank you so much. And so Alisha Peterson, I just want to thank you very much for being on our 2022 Executive Function Summit. I look forward to many years of collaborating with you and talking to you. So thank you so much.
Thank you so much.